Welcome to the Wake County Eldercare channel, brought to you by Tom Arnold and the great folks of Right at Home Wake County. Today's guest is Ashley Beta, Regional Director for Pruitt Health. Today's topic is the Mayview Skilled Nursing and Rehabilitation Center at the Oaks at Whitaker Glen.
Good morning, everyone. I'm Tom Arnold with the Eldercare channel here in Raleigh, North Carolina. I'm here today with Ashley Beta, who is the Regional Director of Pruitt Health. Welcome, Ashley.
Thank you. Happy to be here.
Tell us a little bit about Pruitt Health, and I know you're the Regional Director, but we're here today at Whitaker Glen and Mayview, but I want to first talk a little bit about Pruitt.
Sure. Pruitt Health has been in operation for over 46 years. We started off as a small pharmacy in Toccoa, Georgia, with a great big dream, and here we are over 46 years later with over 100 healthcare centers to our name in 4 states, North Carolina, South Carolina, Georgia, and Florida. Here today in the Raleigh-Durham area, which is part of my area, as well as northeast, the coastal part of North Carolina and some of western North Carolina as well.
Well, sounds like you do a little bit of traveling.
I do.
So, you mentioned a lot of things of Pruitt's history. What they're tell me a little bit about everything that Pruitt's into today. I know you have independent living, which is here at Whitaker Glen, we're all in Mayview, which is what we want to talk about, which is a rehab and rehabilitation health center.
Sure. Well, like I mentioned, we started off as a one-store pharmacy in small Toccoa, Georgia, and now we have Pruitt Health Pharmacy Services. We also have home health, hospice, independent living, healthcare centers, assisted living communities. We also do home infusion. We have consulting services, veterans affairs. That's just to name a few. So primarily those are our big focus, but we also do some source programs in Georgia, which helps with the Medicaid program. We also started Pruitt Health Premier, which is like a Medicare Advantage program, which is like Medicare replacement program. Down in Georgia, we started that, and we're slowly moving it into North Carolina will be next. So we're very excited about that, to offer that to our patients, which is our own Medicare replacement plan.
Of course, we're here in Raleigh, North Carolina today, and I know you have facilities in Raleigh and the Durham area. Tell me about the facilities you have in this community.
Sure. We have 5 locations here in the Raleigh-Durham market. So we have 2 in Durham, and we have the 3 here in the Raleigh area. And then, of course, moving down, we have High Point over to the coast. We do have some in the mountain regions, and then in eastern North Carolina as well.
Okay. Well, let's talk for a moment about Mayview. I've been in Raleigh for 35 years, and it wasn't long after I moved here I heard about Mayview, and I know it's been around a long time. Tell me a little bit about the history of the facility and what you do at Mayview.
Sure. Well, Mayview's been around for a long, long time. Over 59 years, Mayview's been in business. Mayview was a tuberculosis hospital many, many years ago, a long time ago. It was a tuberculosis hospital. And it was taken over by a family here in the Raleigh area, and we took it over from them in 2010. It was acquired by Pruitt Health. So we're happy to have been running it since 2010. We take short-term patients for rehabilitation in Mayview, as well as long-term care patients. Most insurances we take, private pay, Medicare. All our beds are most of our beds, I should say, are Medicare and Medicaid certified. We do have private pay beds only. We have the largest amount of private pay beds in the Raleigh area. We are also inside the Beltline, which I always like to mention for Raleigh folks. That seems to be a very big deal in the Raleigh area. We also have 1 of 2 secured locked memory units here in the Raleigh area. We are one of U.S. News and World Report's best healthcare centers the last 2 years running. We are, of course, ACA certified. That's the American Healthcare Association. 5-star facility the past 5 years, deficiency-free the past 5 years, which are those health surveys that every skilled nursing center undergoes every year. which basically tells how good of a job you're doing based on the surveyors who come inside your building. We have very, very good rehab services that our patients undergo when they come in, and we rehab them as very best we can to get them back to their baseline so they can go back to their prior living arrangements, whether that be assisted living or independent living or back to their home.
Yeah, I know as owner of Right at Home in Wake County here in Raleigh, we have had many of our clients, we call them clients over the years, have utilized the services at Mayview. Many of them coming out of a hospital stay and going directly to Mayview to rehab before going back to their residence.
That's right.
And over the years, I know a lot of our people have benefited from their stay, whether it be short or long term at Mayview, and speak very highly of it.
Yes, it is a wonderful building. It has a lot of history behind Mayview.
Tell me when a person would utilize Mayview. Would that be coming out of a hospital environment, or going? What is your typical resident or person in Mayview?
Sure. The typical guest would be somebody who's had a hospital stay for some type of acute condition, whether that be a fall which related in a hip fracture or a knee replacement. Maybe it's an orthopedic event, but it could be that they've had pneumonia or a COPD exacerbation, or maybe they have congestive heart failure flare-up, or they've just had a medical issue that's required hospitalization. They've, of course, been deconditioned while they've been in the hospital, so they come to Mayview for a rehab stay. We give them the appropriate therapies that they need, which might be physical therapy, could be occupational therapy, speech therapy, all three, or a combination of some. They might also require wound care, some type of nursing skilled service. It might be IV therapy. It may be through a peripheral IV line. It may be through a central line. We are quite capable of managing a wide variety of skilled nursing needs also at Mayview. So that might be the type of patients that we may take at Mayview. We also do take hospice patients into Mayview. We also take long-term care patients into Mayview. So there may be a patient that's in the hospital that the family realizes they're just not going to make it back to their prior living arrangements, and we can also take them long-term care into Mayview.
Well, I know I've never heard anything but great things about Mayview, and you guys do some wonderful stuff over there.
Yeah.
What makes you different than maybe a similar facility in the community? Is there anything that stands out that you want our audience to know?
It's the people that are inside Mayview.
Yeah.
It's the people that are inside Mayview. They are first class. They're top notch. You won't find any finer in any other center, I believe, in the Raleigh area. That's not Pruitt Health. That is anyway. That is.
Well, I think that's probably true of any good facility. It's the people that make the organization. It's their empathy and the compassion they have for the people they care for.
It is, and it's the line staff that take care of the patients that truly make Mayview a wonderful place. People are always happy with customer satisfaction. Customer service is top-notch. Nursing care is second to none. Obviously, they're deficiency-free for the last 5 years. They're a 5-star center, so you just really can't beat the care that you're going to receive when you come to Mayview.
Well, Ashley, thank you for joining us today. This interview obviously will be on your site, on the Eldercare channel, and that's WakeCountyEldercare.com for our listening audience. And we hope that anybody who's in need or interested in the services that Pruitt provides at Whitaker Glen or Mayview, they go to your site on the Wake County Eldercare channel and check out what you guys do.
All right, well, thanks for having me.
You're welcome.